Allergies are a major cause of skin disease, discomfort, and distress in dogs and cats. Pruritus, or intense itching, is the most characteristic sign of allergies. This itching is caused by the release of histamines from mast cells located throughout the body. Hair loss, redness, and skin infections may result secondary to the allergy. Over time, the hair coat may become stained from excessive licking, and the skin may become dark and thickened. Ear infections may also result from allergic conditions. The two most common types of allergic conditions exhibited by pets are those of inhalant allergies and food allergies. Histamine release is the result of exposure to a substance that is foreign to the body, called an allergen. Allergens that your dog or cat might be sensitive to include plant pollens, chemicals, drugs, carpet fibers, insect venom, fruits, grains, meats, or many other items. These allergens primarily enter your pet's body by inhaling or breathing them into the lungs or through ingestion. Allergic symptoms occur when the animal's body over-responds to the presence of this foreign material. Your veterinarian may diagnose allergies in your pet based on a thorough exam, a history of symptoms, and possibly more specific allergy testing. Mast cells that release the histamine can be located anywhere in the body, but they are most prominent in the skin of the feet, ears, around the eyes, and under the legs. This is why animals with allergies tend to have itchy skin, feet, and ears. Because allergies are a disease directly associated with the pet's immune system, it is important to recognize that the goal of therapy is not to cure this ailment, but to control its unpleasant symptoms. The treatment of allergies can be achieved by using three methods: removal of the allergen source, suppression of the itch with antihistamines or corticosteroids, and gradual desensitization of the immune system to the specific allergens affecting the pet. The removal of the offending substance is appropriate if the allergen source is a food item, flea saliva, or something that is easy to remove from the environment. Elimination of certain diets and food trials are often implemented if food allergies are suspected. If flea bites are the problem, it will be necessary to eliminate fleas on the pet. Your veterinarian will suggest the appropriate flea treatment for your dog or cat. Many allergens, however, are difficult or impossible to remove, such as pollen in the air or house dust. The use of antihistamines or corticosteroids is the second method. Antihistamines act by reducing the release of histamine by the mast cells and are often very effective in controlling allergy symptoms. These medications, however, must be given regularly in order to be most effective. There can be a slight sedative effect associated with the use of antihistamines, which can also reduce an animal's tendency to scratch. There are many safe, effective antihistamines available for use in dogs. Your veterinarian may try a variety of different antihistamines until they discover one that provides acceptable results. Corticosteroids act in many ways to suppress the allergen reaction before and after the allergy develops. Steroids are very effective, but must be used with caution. If used excessively, adverse effects can be seen. The use of steroids can also result in compromised immune system function, reduced healing, chronic infections, and an inability to produce natural steroids. Because of the often extensive self-trauma associated with allergic conditions, antibiotics are often administered to control the secondary infections that are frequently present. In addition to these medications, frequent baths using shampoos formulated with ingredients to soothe the skin can be helpful in reducing allergic symptoms. Nutritional supplements containing high levels of fatty acids and other skin-nourishing agents can help keep the skin healthy and reduce itchy symptoms. The final treatment option is the process of desensitizing the patient over time. This desensitization process begins by identifying the allergens that the pet is sensitive to through special intradermal tests or blood evaluation. Once the allergens are identified, specialized mixtures of these substances are combined into an injectable form that is given at regular intervals. With time, the pet's immune system response to these allergens diminishes, and many pet owners note measurable improvement in their pets. It is important to remember, however, that even this is not a cure for allergies, but an aid in reducing the clinical symptoms. Pets suffering from chronic allergy symptoms may be good candidates for allergy desensitization. When ingestion or food allergies are suspected, a food trial lasting 6 to 12 weeks may be done. This involves changing the diet in an effort to eliminate possible allergens that may be present in the current diet. Complete compliance to the trial diet is needed for the trial to be of any value. Proteins and grains are common culprits, so new or novel protein and grain sources are often used. There are many diets for your veterinarian to choose from. Other diets utilize ingredients that most domestic dogs and cats have not had access to in their diets: duck and potato, venison and green pea, or even kangaroo and barley. All items ingested must be considered and no outside treats can be given. Your veterinarian will likely be assessing your pet's allergy symptoms and will form a therapeutic plan that suits your pet's needs. A combination of the different therapies discussed is often needed. The management of highly allergic pets can be a very challenging undertaking, but the results obtained dramatically improve the quality of life for both you and your pet.